Hi, this is Dr. Yoon Han Kim. I'm a functional medicine physician and expert on LDN. And the question that we have today was about the how does LDN have effect on CRP and ESR? So ESR and CRP are two inflammation markers we use very commonly. Both are sensitive but not specific. That means that we know there's inflammation, we don't know what that means. We do have other markers like ANA, anti-nuclear antigen, and when that's positive, there's a slew of other tests that get triggered as a reflex, and that's kind of how our colleagues in rheumatology often make diagnosis on what kind of autoimmune conditions people have. So what we have to do is review one of the studies that was done in Stanford University by Dr. Younger. And Dr. Younger did a trial where he treated people with fibromyalgia with LDN. And what he found is very fascinating. If in fibromyalgia, in the classical form, is a non-inflammatory pain syndrome. What in reality, you don't always get that. Fibromyalgia becomes kind of a bucket where everything that people don't know what it is falls into the fibromyalgia. In rheumatology, there's a similar bucket that people, if they don't know what it is, they will put it in the bucket, either fibromyalgia or another bucket that is um, commonly used. So for this purpose, what Dr. Younger found is that yes, if you do use LDN, then people do get better. But what he found fascinating is that if these people had inflammatory marker, ESR or CRP elevated, those people were even more likely to improve with LDN. So when I read that article, it gave me idea that LDN is not what people are thinking. People think that LDN work solely by being an antagonist to opioid receptors, by blocking endorphins, and the body overcomes the blockade, produces more endorphin. I think that's just one mechanism. We also know that LDN works as a toll-like receptor antagonist, and toll-like receptors are distributed in glial cells, in immune system, and uh, in the nervous system. And by modulating or blocking or preventing the glial cells to become activated and become pro-inflammatory or super inflammatory, I think the LDN keeps inflammation down. But it seems like Dr. Younger's research showed that there may be even another mechanism we do not yet know that plays more direct anti-inflammatory role. So I know that this person who asked was wondering what will happen to the lab. I wouldn't be surprised if the lab shows improved inflammation. Now, having said that, there are multiple other ways to reduce inflammation. One of my favorite way is using anti-inflammatory diet, which I can talk about another time. Another way that you can improve inflammation, CRP, ESR, sometimes is anti-inflammatory supplementation, such as combination of fish oil and curcumin, boswellia, etc. But LDN definitely has a chance to lower inflammation, and if you have high inflammation, it's more likely that your condition will respond to LDN. Thank you for the question.